So there's a very common misconception around Ayurveda and cancer. And this keeps coming up as cancer cases come up and more people are get to sort of stage 4 cancer. There's no more that clinical medicine can do for them. And so many people have then turned to Ayurveda or other sort of ancient Indian healing techniques. A lot of this is fueled by case studies in sort of tabloid newspapers talking about someone who went to an Indian health farm or something and got cured of their cancer after someone gave them a few months to live. These stories abound, especially around in sort of today's era of social media. There are so many stories like this shared, and they're not that reliable. We can't trace the source of them. We can't prove that they're true or false. But one of the things I noticed in my research is so many people, when they're given a very bad short prognosis from clinical medicine, that's when they turn to Ayurveda. And that's a real problem. So when I talk to practitioners in the UK, registered sort of legit practitioners, they said that's terrible. If clinical medicine has given you a 6-month prognosis, has said that there's no more, they can only offer palliative care, there's no more sort of curative therapy that they can offer, then it's too late for Ayurveda. Ayurveda can't do that either. And a lot of them have no faith in these stories. Even though they are Ayurvedic practitioners, they don't believe that Ayurveda can cure cancer. But that's because Ayurveda is not a curative system. It's a system of maintaining well-being. And actually, there have been a lot of studies in various countries, Hong Kong, Germany, around the sort of key ingredients or sort of herbal materials that we use in Ayurvedic medicine. So the actual herbal medicines that have found what I guess are called anti-cancer properties, and they're about reducing your risk of getting cancer. So that's way before the stage where you have like a stage 4 prognosis or something. They're about preventing you from getting cancer. And that's what Ayurveda is really about, is about giving sort of supplementary healthcare and prevention. The other thing that a lot of Veds told me is that when someone comes to them saying that they've only got a few months to live, they're at sort of stage 4 cancer, they're only getting palliative care. That's where Ayurveda is really valuable for them, in giving them palliative care that's more in line with their lifestyle, getting that personal attention from a Ved at the end of their life. That means that if their leg is hurting because of a buildup of fluid or something as a result of the cancer, there's not much that the GP is going to be able to do for them, if they can even get an appointment. But the Ved can be there and help them, can give them sort of spiritual comfort, can give them maybe like a massage oil, can help them with their diet to help them get through sort of like the pain and the discomfort of the last days of their life. And so what we see here again is an integrated system between Ayurveda and clinical medicine. Again, is so much more effective than trying to make a choice of one or the other.